Hopefully by now you understand that obesity is not a simple disease and that it is in fact quite complex, and that everyone's path to a higher weight or to obesity is often very different. And we want to ideally approach individuals with an open-minded, non-judgmental view and work with them to establish something that's going to actually work for them. But one of the main things that limits effective obesity treatment or management is a concept called weight bias. And weight bias is pervasive when it comes to healthcare. Okay, so what do I mean by weight bias? Weight bias is negative weight-related attitudes, beliefs, assumptions, judgments, etc. towards individuals who are overweight or obese. So thoughts like beliefs that people that are obese are slow, lazy, unhealthy, undisciplined, they lack motivation, they're disgusting. All these kind of beliefs or attitudes impact an individual's ability to get proper treatment and to be accepted or seen as an individual. So weight bias is something that contributes to weight-based discrimination, which is prevalent, like I keep saying, in both health fields, in personal training fields, in nursing, in psychiatry, in all sorts of different disciplines. Although some people think that weight bias isn't a big deal, it can have a damaging effect on someone's both physical, mental, and social well-being. And it limits our ability to properly address and make a difference in obesity. People with obesity are still people. People with diabetes are still people. Okay? People with cancer, lung cancer, who smoked all their lives and got cancer, they're still people. Okay? So just because individuals with obesity wear their disease, they wear it for everyone to see. You know, we sometimes think that it makes it okay for us to shame them or treat them poorly. And I just really want to encourage you to take a step back and to examine some of your own biases against individuals with obesity or individuals that are different from you in general, so we can start making a difference in how we treat other humans so we can have, ideally, a better society. Okay? So when it comes to bias, let's just be honest, we all have biases, no judgment. I have biases. I work really hard not to, but I still have them. So an explicit bias is often very obvious and it's very known to the person, right? So I don't like this kind of person. I don't like people that look like this or are this color or are this size or whatever else, okay? And to check if you maybe have explicit bias when it comes to individuals with obesity, you might want to take something called the Anti-Fat Attitudes Questionnaire, which looks more at explicit bias. Okay? I don't have explicit bias with individuals with obesity. However, I would be lying if I had said I have no implicit bias. And I would be lying if I were to say that I have no implicit bias when it comes to things like color or it comes to things like age. And although I would never say I don't like and I don't believe mentally, I don't like this kind of person, this color of person, or this age of person, there are things that are built into us that are kind of below the surface, what we called implicit biases. They're unconscious. You don't really realize you have them, but they're there. And that might affect the way you treat people even without realizing it. So I was raised around a lot of white people. You know, I'm Hispanic, but I present white. And I know that that has colored my view of the world. So I don't really think that I have biases. I don't think that I have explicit biases, but I know that I have ones deep down that I'm still trying to decondition and work through, right? So if you want to know if you maybe have some of these implicit biases against weight, against color, against other things, right? Political orientation, okay? Try the implicit associations test. It's not perfect. It's a Harvard test that kind of presents different images and it has you test your bias on things. Okay, so the question is, do you have weight bias? Are you weight biased? Honestly, probably. Am I? Probably. You know, and I actually think I overcompensate sometimes, like I'm extra nice to individuals with obesity, but I think that's because of some implicit biases I have, internalized biases I have against certain individuals that, again, I'm trying to decondition. But the first step is acknowledging it. Okay? And I realize that that's not right, and I don't want to feel that way or to be that way. Okay? But knowing that we have these biases, no judgment, it's the first step in making a difference in, like I keep saying, deconditioning them, so we can have more of a fair and an equitable world. Okay, so once we know we are, and we are, you might not think you're biased to X, Y, and Z, but you probably have some of these internalized ones. Once we know we are, then we can start, like I said, doing something about it. Okay? So when it comes to bias with respect to weight, Rebecca Pull, she's done a lot of the research on this. She's really worth looking up on this. What they have found is that the number one source of weight bias that individuals with obesity find is with family members. 3/4 of individuals with obesity have stated that family members have treated them differently or stigmatized them because of their weight. Doctors are number 2. Okay, nurses, about half of people with obesity have found that they've had weight bias from nurses, dietitians, mental health professionals, and this again impacts care, and it impacts things like self-esteem, it impacts things like mental health. Okay, and although some people think, well, if I treat people with obesity kind of shittily, then they'll change, that's not what happens. Okay, and actually the opposite happens. Okay, so I'll give you some examples of weight bias in a healthcare setting. Okay, so this is from patient experiences. I think the worst was my family doctor, who made a habit of shrugging off my health concerns. The last time I went to him with a problem, he said, "You just need to learn to push yourself away from the table." It later turned out that not only was I going through menopause, but my thyroid was barely working. The second one just breaks my heart too. I asked a gynecologist for help with low libido. His response: lose weight so your husband is interested. That will solve your problem. I became very frustrated when a doctor disregarded what I was telling him because he had already made up his mind that obesity was at the root of all my problems. So these are just doctors, but there's other examples as well. But it's again just seeing the person as their disease instead of seeing past that and trying to understand what's going on. Okay? So this is a classic cartoon when it comes to weight bias. Doctor, I've been impaled. There's like a 2x4 through this person. Maybe you'll feel better if you lose some weight. And that's often what individuals with obesity deal with in a healthcare setting, that everyone thinks that everything has to do with their weight. But there's other things that, that are going on that are beyond weight that are worth examining as well. And again, we're not seeing individuals as people. We're seeing individuals as their disease. Okay, and this does not promote equitable health. Okay, so here's what we see with weight bias and obesity. Right, so an individual has obesity, of course there's health consequences of that, so they need to go to the doctor more. But when they go to see the doctor or the nurse or the healthcare professional, they encounter these kind of statements. They encounter these kind of situations. Okay, so do you want to go back to that doctor? If a doctor said something to you like that, if a personal trainer said something to you like that, do you want to go see them again? How is that going to make you want to go see the next doctor or the next nurse, right? So individuals that experience weight bias, they're more likely to avoid healthcare. Okay, and if they avoid healthcare, those unhealthy behaviors, etc., might get worse, and that disease gets worse as well. Okay, so weight bias in health limits our ability to make an actual difference. Okay. So like I said, sometimes people think that if I shame people, if I make them feel really crappy about their weight, that's going to make them change. And that's just not what the research shows. Individuals who experience weight bias are at increased risk of binge eating. They're more likely to do extreme dieting to the point where you see that yo-yo cycling. They might just fully refuse to do anything, very much like avoidance. Like, I hate this bias so much that I'm just not even going to do, I'm going to do the opposite. Okay, avoiding physical activity. If you've encountered weight bias at a gym, It breaks my heart when I see people laughing, or I see on the internet people laughing at individuals at the gym that are larger or that are trying. Why would you want to go back if you're made to feel so crappy? They're trying to make a difference and then people make them feel terrible. Okay, it can increase stress and increase poor quality of life. So there's a whole slew of consequences of weight bias. Okay, so things to consider about weight bias: it is common, it has adverse physical, mental, and social effects. Like I keep saying, shaming people about their weight does not work. I know that people use shame on themselves. I know that people are like, when they overeat, they tell themselves things that I don't believe you should say to yourself. Internalize weight bias things like you're fat, you're disgusting, etc. And maybe that works on the surface, but how good is that for someone's mental health? How good is that sustainably as an approach? So we think shaming works, but it really doesn't in the long term, and that's not a loving approach, and that's definitely not a humanistic approach either. When individuals have internalized weight bias, they might think they deserve to have terrible health. They don't deserve love. They don't deserve to feel good, right? And these kind of things can really impact self-esteem, self-worth, which of course limits their ability to maybe change some of those behaviors that they might have wanted to change. Okay? We have to be careful in public health interventions, because sometimes best laid plans are actually poorly laid plans. And sometimes we actually promote weight bias by some of the interventions we have. So we have to be careful with language. We don't want to say like, you don't want to be fat, do you? We don't want to say things that are like it's shaming in nature, promoting weight bias and weight stigma in nature. Okay? Social inequity is one of the things that both can increase the risk of obesity, and it also is seen with weight bias. What I mean by this is, for instance, individuals with obesity are less likely to be hired. They're less likely to get a promotion. They're less likely in the States. I think you still do, put your picture on your college application. And individuals with obesity that were equally qualified were less likely to get accepted. There's all sorts of weight-based discrimination that occurs because of weight. Okay, and again, people might be like, well, it's their own fault for being large. Okay, would we say to someone, well, it's your own fault for getting lung cancer, it's your own fault for getting cardiovascular disease, it's your own fault for getting, whatever you got. Okay, so this kind of approach, this kind of thinking does not help. Okay, and we need to look past maybe, some of these biases and again start looking at people as individuals and understand what's going on for them. Okay, when we want to take action on weight bias, we have to think more upstream, political level, population level, to kind of change those attitudes, those norms, those like values of the society. So we have better, more humanistic approaches to dealing with individuals with obesity. Okay, so some things that can help reduce weight bias in a health care profession is to really make it clear the complex causes of obesity. If people have a reductionist view of obesity, that really limits their ability to understand how complex it is and to understand that it's not as simple as people think it is. Okay? Also, by having positive interactions with individuals with obesity, you can get to know them as people. They're just people. Like everyone else, we're just people. We all deal with different things. By having positive interactions, we again get to see them as more than just their disease. Okay? One thing very important that the Canadian Obesity Network does is they feed all their obesity experts. They don't use anyone for communications that doesn't have an empathetic view of obesity and an understanding view of obesity. Okay, they don't put out weight bias messages. And actually one of their main mandates is to reduce weight bias. Okay, and again, repeatedly interacting with people living with obesity, it helps to build that empathy, that compassion, and that understanding as well. Okay? So to reduce stigma in healthcare settings, we want to improve the attitudes of us, our own attitudes. Also providing a comfortable environment, you know, having appropriate chairs, having appropriate access points, having good, let's say, graphics or those kind of things around that helps people feel welcomed. And also something important here is empowering patients to cope with weight bias and advocate for themselves to attain high quality care. The patients themselves, ideally, when they know also that obesity is a complex disease and they don't deserve to be treated that way, and they have their own sense of self-worth, ideally can also be empowered to speak for themselves and to change some of the stigma around obesity. But that's hard when you've been stigmatized your entire life. Okay? Other strategies: keep up to date with obesity management, ensure a patient-centered approach, not a my ego-centered approach. Use appropriate language. In obesity, we talk about people's first language. So instead of saying a diabetic person, we say a person with diabetes. We don't say a cancerous person. We say a person with cancer. So we say, and you'll notice that I've done this throughout this lecture, I talk about individuals with obesity, people living with obesity, right? Same with, like, we don't say homeless person anymore. We say an individual experiencing homelessness, okay? And you might want to use these words: weight, excess weight, BMI, weight problem, instead of things like large size, fatness, or overweight status. But it really depends on the person. We're all kind of different in the terms we like to use. Okay. The other major thing I recommend is using the Canadian Obesity Network's 5 A's. So first A is when you're interacting with someone with obesity is ask for permission to discuss weight. Can we talk about your weight today? Is it okay if we talk about your weight today? And if they say, no, I don't want to talk about it, okay, maybe we talk about it next time, or maybe we talk about something else, okay? Assess the causes of obesity, okay, and any kind of risks that they have about that obesity. So remember, trying to figure out their own map. We might want to advise them on their health risks. If they don't know them, they probably already do, but they might not, okay? And the treatment options available. They might not know things like the pharmacotherapy options or the bariatric options, okay? Agree. Instead of telling them what to do, be like, what do you think could be a strategy that you could work on this week? Do you need advice, right? About that as well. Advice about that as well. And you might also, if you know of other programs that exist that have a welcoming and appropriate approach, you might want to help them get into the right kind of program that can focus on their specific needs too, okay? So a multidisciplinary team is often one of the best strategies for individuals kind of managing their obesity, especially when it's at a higher level. So a really good example of this is something called the Obesity Medicine and Diabetes Institute, formerly called the Medical Weight Management Center, which is in Coquitlam. And this is, I love this program. This is a medical weight management program completely covered by provincial health care. And you'll notice some of their main messages: weight can be a serious problem, serious matter, lose weight only to regain it later. How common is that? Obesity is rarely a simple problem. Okay, so they highlight some of the things that we've talked about. There's Dr. Michael Lyon there. And you'll notice that they have a multi-pronged approach: medical management, so like bariatrics and pharmacotherapy, and doctor-based visits. Okay, they have group medical visits as well, lifestyle management, mental well-being, and bariatric surgery. And they have modules that focus on all sorts of different factors that individuals with obesity might be dealing with. Okay, so they have a medical team, they have a bunch of internal medicine doctors, family practice doctors. There's one of the founders and one of my really good friends, Veronica. She's the main dietitian and the head of the bariatrics program. We see some former BPK students there, Karen, who I worked in a lab with myself. And we have Cindy, who just graduated a few years ago from BPK, and Tessa. Both of them took 417 with me. But you'll notice that they have, Ben, he's another BPK student, you'll notice that they have kind of this multidisciplinary team that focuses on the different areas that might be promoting obesity. Okay, let's say you never work here, you never work in obesity. Cool, no big deal. But really what I want to stress here is that your attitudes matter. And the way you treat people matters. And if you are interacting with and helping individuals with obesity or any other problem, It's important to see them as humans first, and to take an approach that takes into account their own set of factors that have led to where they are, and working with them in a kind, compassionate, non-judgmental way, right? Where we're not only ideally improving their physical health, but we're also improving their mental health and social well-being too. Okay, so something to think about as you move into your career as a health promoter.